Hi everyone, it's the Real Deal Sex Ed, and today I wanted to talk about uterine fibroids. They are basically benign tumors that grow inside the uterus, outside the uterus, or they can grow in the uterine walls. They're usually benign, which means they are non-cancerous, and about 20 to 80% of women will develop fibroids by the time they reach 50 years old. They can be diagnosed as early as 30, sometimes earlier, but most start around 30 up until menopause age. African American women are more likely to develop fibroids than white women. As far as age, they say once you get to menopause age, if you do have fibroids, more than likely they'll start to shrink. If you have a family history, or let's say your mother or grandmother had fibroids, you are about 3 times more likely to have fibroids. So that's something you want to, discuss with your health care provider. Make sure that you're keeping them up to date, on things like that, or family history. Make sure you give a full history, whether that be for fibroids or, any other things they ask you for, cancer, things like that, to be sure that they have key things that they can look for, as you get older, to ensure that if you do have these things, they can diagnose them early. Common symptoms, possibly. Common symptoms are, heavy menstrual bleeding, pressure in the pelvic or abdomen area, or feeling of fullness, enlargement of the abdomen depending on how big the fibroids can get, because they can get up to the size of a grapefruit. Pain during sex, frequent urination, lower back pain, those are all symptoms. You can even have complications through pregnancy and labor, putting you at greater risk for having a cesarean section. And it can also cause infertility. Your doctor will be the one to diagnose you. A lot of times they can find them during a regular pelvic check, where they, can touch it with their fingers and feel around to feel that there is a possible fibroid there. They can do imaging with the x-ray, CAT scan, MRI, things like that. Ultrasound to take pictures, to identify and or calculate, or, just see the size. And they also do another type. I've never heard of this, but it's they inject x-ray dye in the uterus, and then they take pictures. And then they can also inject water as well. They also have two types that they use to identify, where they one, you do a tiny incision near the navel, and basically they go in with a camera with the light, and they view the uterus that way and other organs to see if they can spot the fibroids that way. Or a non-incision procedure would be where they go in through the vagina and through the cervix to look at the uterus from the inside out. When it comes to the treatment of uterine fibroids, a lot of times they'll prescribe different birth controls. So it could be the pill, or ones that are progesterone, usually progesterone only, hormonal type of birth control. So a few examples will be maybe Depo IUDs. I know Nexplanon is progesterone hormonal birth control, and that would be to control the heavy bleeding. So that was something that can be prescribed. They may tell you to take iron supplements, because obviously heavy bleeding can lead to anemia. Surgery, it depends on what you have going on or what you're looking to do in the future. So they want to identify things like the size, if you planned on getting pregnant in the future, if you have any symptoms, if so, how bad are the symptoms that you have. Also, the location of the fibroids, that can play a big part as far as surgery, and your age as well. So depending on those factors, they do have specific surgeries where they can go in and take out a few or a couple of the ones that are really big, to try to alleviate some of the symptoms or the pressure or the pain. If they can get them all out, I'm sure that'll be great, but it would depend on the location. Sometimes people may have to eventually get some type of ectomy to remove probably all or part of the uterus. So that's why it's good to talk with your doctor, because they can basically tell you what's right for you at that whatever point in your life that you are, whether, again, kids, things like that, whether you want to do in the future, So talking to your doctor always helps with things like this, especially when it comes to surgery. But they do have a few procedures that will help with that as well. For questions or future topics, my email is therealdealsexed@gmail.com.